Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
The topic today in Neighborhood Health Watch is knee and hip arthritis. The adage, move it or lose it, applies especially to people with osteoarthritis. Physical activity is important to overall health, of course, but it's even more important to people suffering with arthritis. It can be debilitating, which usually happens when a person's joint doesn't get enough exercise. Dr. Shaia with Parham Doctors Hospital is joining us now to talk more about it. Let's talk about this vicious cycle that first, when you move less, it becomes more painful. But still, if you don't move, you lose your ability to and movement in that joint.
So we're talking about arthritis, and arthritis is the wearing out of that normal healthy cushion that lines the end of bones that make up a joint. So as that cushion starts to wear out, it can be painful to move, and joints do get stiff.
What are the best exercises to consider doing, and what are those type exercises that you should stay away from?
Well, the best exercises for those who are at risk for arthritis or who have early arthritis are the low impact or no impact activities that raise your heart rate, to an appropriate level to get exercise. Those things like walking, cycling, elliptical, swimming, those kind of things.
Running, jogging are not a good idea?
So for those who are at risk for arthritis or have early arthritis, the high impact activities like running are not great.
And you have some props with you today. We think of exercise, I guess, as the first step towards treatment and living a less painful life with arthritis, but at some point surgery might be necessary.
Yes, so once conservative measures, alternative activities, medications, corticosteroid injections, once those are no longer effective, then we talk about surgery to replace the joint.
And what you have here, what I'm holding here, which is really kind of heavy, this is a hip replacement.
This is a hip replacement, exactly. So this part of the implant replaces the ball of the hip. It has a stem that goes down into the thigh bone. And this part of the replacement replaces the socket, and then there's a...
And how do you know when a person is at that point where they might need a hip replacement or a knee replacement?
Well, a good rule of thumb is when patients are not as active as they would otherwise be because of hip or knee pain, and they have not responded well to conservative measures, it's time to replace the joint so that they can get back to an active lifestyle and remain healthy.
Wow. Wow. And what can you expect from that type surgery? Do you expect complete recovery or...
Patients do very well. Hip replacements and knee replacements have among the highest success rates of all surgeries that we do. Over a course of 2 to 3 months, patients get back to a very active lifestyle of things like cycling, walking, elliptical exercise, and everyday activities. Walking around the mall, walking around the neighborhood, walking their dog, doing chores around their home, taking care of their lawn, things of that nature.
All right, Dr. Shaia, Parham's Doctors Hospital, thank you so much for joining us. We appreciate it.